Hi, my name is Nicole, and I will be your speech language pathologist. It looks like you described that you are having a sudden voice change and you had an upper respiratory infection. I'm so sorry to hear this. I know it can be really aggravating and painful. Um, it seems like during that time this was occurring, you were in court working as a lawyer, and you were using your voice a lot of that time. So based on what the doctor said, I reviewed his report, and it looks like you have a vocal fold polyp on one of your vocal folds. This is totally common for people who use their voice a lot in their daily life and in their work life. Um, so basically, a vocal fold polyp is like a small sac that sits on your vocal fold. The sac is usually fluid filled, so you can think of it as like a bubble or a blister. And when this sits on your vocal fold, it creates like a bump. So the vocal folds normally come together like this, forming a nice cohesive seal, a line when they vibrate. But when you have a bump, they're not going to come together as easily. It can cause irritation, and essentially they're not closing all the way, and some air might leak out. So this may cause a change in someone's voice. Their voice may become harsh, kind of rough sounding, um, and really affect their quality of life on a daily, day-to-day basis. And your voice can definitely fatigue a lot faster than it used to. So, based on all of this, do you have any questions so far? Okay. So, based on your explanation and the symptoms, I can tell that this is really affecting you, especially because you are a lawyer, and I know it's so important to use your voice in your job and in your social life, as I see you do enjoy going out, and being in restaurants, which is typically, a noisy environment to be in. So I'm going to demonstrate some strategies to help you improve your voice quality and reduce that strain and any pain that you're having over the course of our next few sessions together. So, one strategy we can do is called resonant voice therapy. This strategy promotes a strong voice with reduced effort on the vocal folds. So essentially, we're trying to heal that polyp on your vocal folds by creating less collision um, and abruptness in the movement of the vocal folds coming together. When vocal folds come together, they vibrate. So in resonant voice therapy, we try take that vibration and bring it up to resonate in our cheeks, our lips, and our nose. So the first thing I want you to do is just to sit up straight. We want to have good posture when we're doing this and try relax all of our muscles. So first, I am going to model what I want you to do. So first, just make a hum sound like a hmm. Your turn. Okay, great. So now you're going to take that humming noise and try bring it up into the front of your face. So we can bring our hands to touch our face gently and feel the vibration in our face. So, mm, okay, now you try. Okay, great job. So after this, then we're going to hum with more of a variation in the pitch that we're humming in. So, Mm, you give it a try. Okay, perfect. So these um, are two things you can easily practice in the morning before you're going to work or before you're going out um, at social events. But just to warm up your voice and promote that resonance up into your face. So the last step we can do is start adding um, words to the hum. So this would look like man, many. So we're taking that hum and that vibration in our face and transitioning it into a word. Now you can give that a try. Okay, great. So now we can move into the phrase level. So, man in Maine. So we're dragging out that sound and promoting the resonance in this general region. So, another tip that can help is when you're in noisy environments, such as work, if possible, you can use a voice amplifier. Um, and this will allow you to talk at a normal conversational level, and the amplifier will project your voice, so you won't have to feel the need to talk over anyone or shout, and this will reduce um, the strain on your vocal folds. Another thing I recommend is drinking water daily, um, a good amount, because this will hydrate your muscles and it will create more of a lubricant for when your muscles come together because your vocal folds are muscles. They'll come together and they won't um, be as dehydrated and they'll come together and be smoother when you're talking. And then I also would recommend practicing these techniques multiple times a day. The great news is that you can do this in the car um, when you wake up. And these vocal fold polyps, like I said before, um, they can improve with voice therapy and they're not dangerous. So you should see improvements as we continue to work in speech therapy and in um, your daily life with some changes. Therefore, if you try reduce as much as possible, straining your voice in these environments and taking long rests. So maybe after a long day of work, you actively try to speak quieter, softer, and don't use your voice as frequently. Um, and then by doing all of this, you'll start to see changes and Um, you should have a good prognosis to reducing the size of that polyp and eventually healing it. So I look forward to working with you, and I hope you enjoyed our session today.